Your joint has become arthritic. Why it's become arthritic can be a variety of reasons. It can be because of trauma, where you may have stubbed the toe, sometimes not even knowing, something is shaked off very easily, and then it's gone on to present as an arthritic toe some years down the line. It can also be because of the shape of the bones. Sometimes you'll find that different anatomical variants can give rise to, predispose you to developing wear changes in the joint. Systemic conditions like rheumatoid arthritis or gout can also cause or predispose you to getting an arthritic big toe. I've selected cheilectomy as the procedure in your case because I will have assessed it and felt that the majority of the pain seems to be coming on full upward bend or full downward bend. And when I move the joint a little bit, it doesn't hurt that much. The reason is because the big toe is different to other joints. We find it's a much smaller joint, and a lot of the pain comes from the bone spurs that are formed on the top of the joint. And in the operation, what we're basically doing is removing that lip of bone that's formed to allow more freedom of movement in the joint and to give you less pain. In essence, we're removing as much of the debris, the tissue buildup, but also reshaping the bones so that they can glide more freely. Does the cheilectomy always work? It does in most cases because the pain is coming from, a large part of the pain is coming from the spurs. Some mild discomfort may persist. Sometimes we extend the indication of the cheilectomy, even for joints that are a bit more arthritic than we would like, because it's quite nice because the operation is a smaller one with a smaller recovery. If it doesn't work in a small proportion of patients, we can later convert it to a big toe fusion. The reason it doesn't work sometimes is that either the joint may be too arthritic, or you can imagine if we unlock a joint, then you're using the cartilage more, and then actually sometimes the grinding pain gets more uncomfortable. The spurs can regrow, and usually if it does, it takes many years. You should really expect to have, it should take at least a decade before the spurs regrow, and very rarely do they go on to bother you because we take more than just a spur but also a little bit of the metatarsal head, as we said, to reshape it to give you more movement. There are alternatives to surgery, and these include just simple shoe wear adjustments, like using a shoe where the top is very soft, or a stiff sole shoe where the big toe doesn't bend. The soft shoe means on the top means you don't rub. The spurs don't rub on the shoe and the material, so they're more comfortable. And sometimes a rocker sole shoe, which most sports brands make, can help you roll through the walking cycle so you don't feel as much pain. You can use insoles, and they can support the big toe or keep it stiff so that it doesn't bend again as much, making your foot more comfortable. And steroid injections can also help, but tend to provide a more temporary solution to the problem. The definitive solution, obviously, for big toe arthritis is fusion, but it has a long recovery, and therefore we often like to try the cheilectomy in the first instance. Any operation has risks. These include swelling, which is quite common post-surgery. It's not really a risk, it's just there, and it will go away. But it'll mean that your shoe wear options are a little bit limited for a couple of months after the procedure. Other operation risks include infection, which is usually, if it happens, is mild, and we can normally manage it with tablet antibiotics. You may get some numbness, and you have risks like DVT, which can happen with any surgical procedure, but they're minimized by us allowing you to weight bear immediately. The pain can persist, and it doesn't work for everyone. You must remember the cheilectomy is a tidy up of an arthritic toe, and therefore it can sometimes still cause pain. As I said, the bumps can regrow, but it takes a very long time for that to happen. So what happens on the day of surgery? You will come to the hospital fasted, and we'll give you instructions about the fasting times closer to the date of the operation. Your total stay in hospital is usually about 6 hours. Before the operation, you'll meet the nurse on the ward, you'll meet the physiotherapist either before or after, and they'll teach you how to get around. Now, people are worried about how they mobilize. You don't need to use crutches. We give you crutches sometimes because if your foot's a bit sore, it's nice to not have to put it down all the time, and the crutches takes a bit of weight off the foot. You will be given a shoe. The shoe looks something like this, and it has a Velcro tab that allows us to make the shoe bigger or smaller to accommodate the dressing, and you'll be in this for the first 2 weeks. I'll see you as well on the day, and I'll take consent from you, and hopefully you'll have watched the video and you'll have understood the risks by that stage. The anaesthetist will talk to you about the anaesthetic, but also discuss with you something called a nerve block. The nerve block is a very good way of minimizing post-operative pain. We numb the nerves around the foot so that your pain is very minimal for the first 24 hours, which is when most operations hurt the most. After that, there will be some pain, but we can usually manage that with simple tablet medication. After the operation, once you have something to eat and drink, and you felt comfortable and have seen the physiotherapist, you'll be allowed to go home. When you're at home, try and rest the leg, keep it elevated as much as you can, and I will see you at 2 weeks or thereabouts after the operation. At that appointment, I take the big bandages off, I check the wound, I use dissolving stitches, so good news, no stitches need to come out, and I will allow you to start showering the wound and hopefully wear your own shoes at that stage. So bring what you have with you. Something like a Birkenstock sandal can work well, or a very soft trainer, one of the old worn out ones that you have from before that can accommodate the slightly more swollen foot. And you'll be allowed to weight bear. You'll be allowed to go doing more activities at the gym at that stage. Obviously not running, but you can do low impact exercise like cross trainer or the static bike, maybe the rowing machine. In the meantime, before that, you can do weights and other core activities that you enjoy. I usually see you at one final sign-off at around the 6-week mark, by which stage we'll have been able to gauge if the surgery's helped or not, as by then you'll have got back to some of your normal activities. To shower after surgery, the easiest way to protect the dressing is to get what we call a cast or dressing protector. These are widely available online, and you can get it from Amazon, or even Limbo is a company that does it. It acts as a seal that goes over the dressing like a giant bag, but it's better than using a carrier bag or something, because the chance of water going into the dressing is significantly reduced. If your dressings do get wet, you must contact me because we need to change the dressing. If you have any further queries or questions, obviously you can email the office and I'll try and answer them for you. And do have a look online at my leaflet, which is a bit more detailed about recovery from cheilectomy.